Birth educator for over 5 years. She co-founded a national organisation for doulas in Australia, Doula Network Australia Inc. She recently completed a Bachelor of Health Science with Health Promotion at Western Sydney University and is now pursuing postgraduate research studies relating to health promotion and the perinatal period. So please welcome Christa. Okay, thank you. I am really excited to present today and share some information with you about what a doula is and how they relate to health promotion. This is my first conference, so I'm just warning you, I'm a little nervous, but I am really excited to be part of health promotion. To tell you a little bit about myself, I am first and foremost a mother. I have 3 children and I live in the Campbelltown, southwest Sydney area. And that's significant with something that I'll talk about doulas, in that we are first and foremost community members. Secondly, I am a doula. I've now reached the 6-year mark, so I've been a doula for 6 years, and very early on I realised that there wasn't a lot of networking going on in the doula community and founded an organisation, and we incorporated just 18 months ago. So I'm the president and co-founder of that organisation, and that's very exciting for me as well. And thirdly, I'm a graduate of Western Sydney University, and I'm very proud to be a graduate of this university. It's my local university, and I was so excited when I found the Bachelor of Health Promotion, or the Bachelor of Health Science, majoring in health promotion, because all of a sudden all the pieces fitted together for me. I didn't want to pursue midwifery. And that's one pathway that some doulas go, that we're very passionate about childbirth and supporting women. But I was much more interested in educating, in community involvement and in engaging the community, and midwifery didn't quite fit that mould for me. So yeah, I'm very excited in my progress with health promotion and my degree, and now moving on to postgraduate research studies, so the future is very exciting. In relation to the theme of the conference, Connecting the Dots, my talk will be about a new role which has emerged in maternity care, and that is the role of a doula. Now, the role of a doula has actually been around for around 30 years, but it's not. It's been about the last 10 to 15 years that it's really taken hold. And I'll talk a little bit more about how doulas came about in the next slide. But this new role that has emerged is, by definition, innovative, but it has traditional roots, and that's what I found really fascinating about the theme. So what I'll be doing is connecting the dots and demonstrating how doulas are an excellent example of community action, and we fit beautifully within the paradigm of health promotion. So my argument is essentially doulas are health promoters, and we raise awareness of health issues relating to childbirth, providing education and encouraging community members to be informed and empowered. Okay, so what is a doula? You've heard this word a few times now. The word is actually a Greek word that originally meant handmaiden or woman servant. Has those sort of connotations. It's now become the meaning for a birth companion, a labour companion, or a labour coach. Yeah, so this word has been adopted into the role. So often you'll hear the term birth doula or postpartum doula, and I'll talk a little bit more about that in the next slide. But what we do is we provide non-medical support to mothers and their birth partner. It often involves training, so about a 3 to 12 month training, so in other words a short course, and it is a paid service, so the women in the community pay for this service, and that's around, just to give you an idea, it's for a trainee that some do it for free, and some might charge up to about $350 for a birth. For an inexperienced doula, they may charge between $500 and $750, and for an experienced doula, they could charge anywhere from $800 to $1,500 or more. Often when people first hear those figures, they go, well, that's a lot of money. You know, what justifies that amount? But we're talking about 20 to 40 hours of work. So, and this is one-on-one support. So at the moment, I mean, it would be wonderful if these programs were funding this sort of support, but at the moment, women are paying for it out of pocket themselves. And that's working for the moment, so that's okay, but it's certainly limiting the access for some women. So just a little bit about why this is important. First of all, the benefits of one-on-one support is that it has been shown to have decreased interventions for women during the birth, and also increase maternal satisfaction and improving postpartum outcomes. And this is super important because we have soaring cesarean section rates at the moment. We have actually hit the 33% mark. So it's been climbing over the last decade or 2 decades, and we've finally hit the 33%. So 1 in 3 women are now having a cesarean section. And that is an issue because that increases risks for mothers and babies. So obviously when it's necessary, it's a wonderful intervention that we have to save lives. But the figures are suggesting that there's an overuse of that, and that is putting women and babies at risk. Also, we have very high rates of intervention, and this was highlighted in the Towards Normal Birth policy, which was a policy directive from the New South Wales Health Department. And that was published in 2010, and it involved strategies to reduce the unnecessary intervention. So it's been identified by our own health departments that, and this is a global issue as well, so there's a lot of talk within the birth community about soaring intervention rates and how can we reduce these rates. Well, one very cost-effective solution is one-on-one support. And there was a systematic review, amazing review, conducted by Hodnett, Gates, Hoffmeyer and Sakala in 2013. So it's a Cochrane systematic review, and they highlighted that one-on-one support with a woman who was not part of the hospital system and not part of the staff at the hospital, and who was also outside the woman's social network, in other words, a doula, had the most effective benefits in decreasing intervention rates, increasing maternal satisfaction and improving postpartum outcomes. So there's a lot to say about the work doulas are doing. Okay, and just one other point I wanted to make is that those postpartum outcomes are also very significant, because we currently have quite a health concern with the low rates of breastfeeding and the health burden that can place on us. And also, so at the moment we've only got 15% of babies are being breastfed exclusively for 6 months. We have a really high breastfeeding initiation rate, so about 90% of women are initiating breastfeeding, but that drops very quickly over the ensuing months, and only 15% are reaching 6 months. We also, I'm sure you're all aware that we have a real issue with depression at the moment in the community, and this is extending to postpartum depression. Okay, so on the next slide, I just wanted to show some images of doulas. Now this is actually quite a task to get photos of doulas, because we're usually behind the camera or we're supporting in some kind of background role. And so just to give you an idea of the sorts of things that we do. And one of the things that you'll notice is it's not very exciting. We're not there, we're not the heroes, we're not taking center stage, we are a support role. So some of the things is, you know, supporting mothers breastfeeding, simply giving them encouragement, kindness, care, attention, words of encouragement. It may include massage or physical support, and just being there. And often, sometimes people wonder, well, how does this work with the role of the father or the birth partner? And once again, the doula role is a completely supportive role. So it enhances the support team rather than takes over. So there's some beautiful images there. There's also postnatal doulas, and I just wanted to give a quick note to them that they support women after the birth in whether it's breastfeeding or just, there's a whole range of things they do, maybe nurturing them with food. But the main thing is, this all sounds very good, right? Well, there is one slight problem, and that is that there seems to be a tension that has emerged. Despite the demonstrated positive outcomes, there remains an unease about doulas and what their role is and where they belong in the maternity system. And this is especially in relation to the tension between midwives and doulas. So there is some degree of overlap in their roles, and there was a wonderful study by Stevens et al. In 2011 that explored this, and basically some of the midwives felt that the doulas were taking over their role. But what the systematic review demonstrated was that what the doula does is different to what midwives do. And in fact, it can't really be replicated by midwives, because midwives have other responsibilities, clinical responsibilities. They're busy doing record keeping, managing technology, and maybe looking after more than one woman at the same time. Whereas a doula can be there from the beginning of a birth. There's no shifts, they're just dedicated to that woman. So it is quite different. Now, what I find exciting about, and what I wanted to finish on, is how this fits within the paradigm of health promotion. And the tension that kind of has arisen between midwives and doulas, I think, is because we don't fit within that paradigm. We're not clinical. But health promotion has this beautiful thing called the Ottawa Charter. And when I learnt about this in my first semester at university, my heart jumped for joy, because there we were, strengthen community action. Basically, doulas have emerged themselves out of the community. This wasn't a health promotion program that was developed. It just happened because women love supporting women. And yes, to make it sustainable, women needed to charge for it. But it still is a community action initiative. And it involves all the principles that we hold dear in regards to community action, empowerment, and peer support. So it really resembles a peer support and community-based model. So in summary, I truly believe that doulas represent a successful and cost-effective way to improving health for mothers and babies in Australia. And the work needs to be acknowledged, supported and amplified. And I believe health promotion is the most appropriate forum for that to be accomplished.